Chickenpox is a highly contagious virus. It's caused by the varicella zoster virus. It spreads through coughing, sneezing, or direct contact with the rash. In children, it usually begins with a widespread rash that is accompanied with fever, body pains, and fatigue. In adolescents, they may get the fever, nausea, and body pains before they get the rash. And of course, the rash looks something like this. The rash can begin as red spots, but eventually it becomes fluid-filled blisters that begin to crust over time. This rash is intensely itchy. If somebody gets chickenpox, then the best treatment is supportive care. That's fluids and hydration and rest. For the itching, you're going to need to take an oral antihistamine, and you're going to need to take oatmeal baths. You want to avoid secondary infection from the blisters that you can develop from the rash. So trimming your nails and regular baths can help with that. And of course, for the itching, there's the classic chamomile lotion. If you want to prevent getting chickenpox altogether, then there's the varicella zoster vaccine. People who have had chickenpox before have something called passive immunity, so they don't need to get the vaccine. However, they are at increased risk of developing shingles later on in their life, which is a reactivation of the virus. The cause of chickenpox is usually mild, but some people who are immunocompromised or have other conditions can get severe complications. So if you experience persistent fatigue, dehydration, wasting short of breath, confusion, or severe lethargy, of course it's time to check your doctor. In fact, if you're concerned at all, go see your doctor. The Ministry of Health reports these are suspected and probable cases, so it's really important to just be aware of what's going on and what the symptoms can look like.